This is Mike Hendrickson from Strata Rx in Boston. I'm here with Amit Sinha. How you doing?
Doing well, thank you.
So you're with SAP.
Yes.
And so SAP and the data world, we know that there's a play there, but healthcare, what are you guys up to in real-time data and health?
That's a great question. If you look at healthcare, it's one of the biggest opportunities that we find in rethinking information processing. We believe that data and healthcare can really come together and transform how we practice medicine, how we discover drugs, how we, as patients, interact with our own health, for example. So there's an opportunity there, and hence SAP, with our new technology, SAP HANA, we can process massive quantities of information in real time. And the power of real time is important because if you think of healthcare, we are literally living in the dark ages. With real time, within the window of opportunity, for example, it could be 15 minutes in the doctor's office, with massive amounts of real-time information, could be your recent healthcare data, but also genomics data and data coming from wearables like Fitbits, for example. You can correlate all that, and within that window, 15-minute window, you can do a quick analysis and prescribe something that's personal, unique to you, so that you can stop the wastage and make things more effective. That's why I think personalization and real-time is so important.
Okay, so SAP HANA sitting on top of Hadoop probably, right? Or something like that?
Not really. So let me explain this.
Okay.
So
what is the stack?
So HANA is a new in-memory database
right?
That has grown to become a platform, and then we integrate out to Hadoop as well. So it's sitting side by side. So what Hadoop does really well, it processes it gets massive amounts of data, but stores it. It's batch-oriented mainly. It's good for infinite storage, if you will. But if you want to get insights in real time, in the window of opportunity, you have to have an in-memory technology like HANA to go process the information. And we have a smart data access into Hadoop so that we can bring that data in or decide to keep the data there and still do the analysis. So that researchers, clinicians, patients, when they are looking up information, analyzing, correlating information, we can process that in database. This is where the platform aspects of HANA are important. We can process that in database to come up with a response within that window of opportunity.
Now, who is the typical user consumer of this? Is it going to be a data scientist, or is it a doctor or someone in the food chain of a health organization? Who is it that's going to be the actual?
I think ultimately everyone, but we are focused at this point of time on two big use cases. One is focused on researchers. These are people who are looking at cohort analysis. For example, as an Indian American, I know that I'm at bigger risk of a heart disease on the basis of my genetic and my information, my lifestyle information that I already know. And they're looking at across population, across cohorts, and doing analysis at that level. They're looking for patterns. They're looking for unique things that they can discover so that they can prevent things and help with wellness. Or even in drug discovery and research, they can find new pathways. The second thing is about personalization, and this is about the clinician, for example, the physician. They are going to look at data and personalize the care, hopefully at the point of delivery to you. And that's the second class of users, which is in the doctor's office, looking at all information in real time and making sense of it and asking questions in real time. I think eventually where we are also headed is end consumers, patients like you and me, or people who care about our health. And we have an interesting app called Care Circles. I encourage you to go to carecircles.com. It's an app for free, meant for end users, where they can get not only themselves but the care team together, the physician, the parents, or extended family members. And there are care plans, authorized care plans from different providers to really tailor it to you. And we think in the future such tools will be very common for end consumers, and not only care plans but also more information, whether from EMR or genomics or wearables, will come into apps like that.
Okay, so wearables would lead to both real-time data and kind of canned data or captured data.
Yep.
So the more that we have of that, who is still going to make sense of that? Is it the doctor? Is it me? Or is it some data scientist? Or is it a combination of all of them?
All of them.
Yeah.
In fact, if you look at common wearable data like number of steps you've taken or walked, these are intuitive things that the end user can understand, And hence there are analytics associated with it that end users have already got access to. But when you look at things like pacemakers, for example, they are about electrical signals, and an end user doesn't understand that. And finding patterns in that is even more difficult. So here we need machine learning, we need algorithmic processing, we need trained minds like physicians who can apply their art to the science, and we need data scientists to look at patterns that was not possible before. We talked about how the amount of data has gone beyond the cognitive capability of an individual now to understand. So data can then recommend patterns, and this is where the intermediated data sciences can inform the end user more. So I think we are tending into that direction where consumers will have access, but I still think there's a place for physicians and the art of medicine as applies to informing patients.
Yeah. So HANA itself, how does someone in a health organization get going with HANA and starting to analyze their data with your platform?
So two ways. We made it incredibly simple. For starters, you can get HANA on Amazon Cloud today for 99 cents an hour. And that's for productive use, for trials and developing, like most startups here at Strata are doing. It's free. You can also buy this and deploy it on premise if you don't want to use the cloud model. And again, for development, deployment, and testing, there's no charge. And then once you go productive on this, there is a charge.
Okay. And if there's one message you have to give all the audience here at Strata, what would that message be?
I think the singular message is that in industry after industry, we have seen how IT and technology has become not only the enabler of business, but the way business is done and conducted. I think healthcare is still in the dark ages. We have a huge, massive opportunity with big data here. IT technology can fundamentally transform. Genomics, wearables, and all these things that are coming in. This is the right time to put our intellectual capacity on a platform like HANA that really promises you amazing new ways of processing information, but that was not available before. And HANA, together with Hadoop, for example, can already get you genetic processing down from days and hours to minutes and seconds. So we have this huge opportunity. It's our imagination that's limiting us right now. So let's apply our imagination, our creativity into healthcare and really change healthcare, because it's about us. It really matters. We have had friends and family members who've died of cancer or diseases that could have been treated. This is personal to us. So I think with technology, I'm incredibly passionate about this topic, and I think all of us are. And that's the message. Let's change healthcare with IT.
Okay, to follow up on that, one question on that. So we have the saying, work on stuff that matters. In all the healthcare area that there is, and all the problems are out there, if you could take HANA and an infinite amount of data about some subject that you could make a difference with, what would that subject be?
I think personally for me, cancer has hit home at different levels. I've had friends and family members die of this. And we had demonstrated at Charité, which is the largest university hospital in Germany, a project called the HANA Oncolizer. What it does is it gets millions, I think 300 million data points from an individual, and then figures out what's the right personalized treatment plan for this. When you think about cancer and aggressive forms of that disease, our goal should be to kind of make this a living disease, if you will. People can live longer life terms, even though it's kind of an aggressive one. And when you think about that problem, we have to get to a personal level. A person who has 6 months doesn't have time to waste on iterative methods. It has to work the first time and every single time. So
getting the cocktail correct and the dosage correct.
Exactly, the cocktail, the dosage, even the food plan, the care team, the community around it, all of it together.
Amit, thank you for your time. This has been excellent.
Absolutely, I enjoyed speaking with you.
Thank you.